One of the greatest gratifications of having practiced hyperbaric medicine and its application in neurological disease now for, 36 years or so, is that the proofing has now been done unequivocally, undeniable evidence for the effectiveness of hyperbaric oxygen in cerebral palsy. Cerebral palsy is a physical injury to the brain, usually occurring either in utero, at the time of birth, or shortly thereafter in children. And about 2/3 of it or so is in premature babies who have spontaneous bleeding in the center of the brain in the white matter tracts. But the tracts that seem to be most effective are the motor tracts, which gives the cerebral palsy the abnormalities that are found in spasticity and decreased movement in arms and legs. In the midst of investigating hyperbaric oxygen therapy for chronic neurological problems in 1992, after we had found success with boxers and divers and a drowned child, I got referred the first cerebral palsy child. Turns out the first one in North America that had been treated with hyperbaric oxygen. And unbeknownst to me, from 1983 to 1989, Dr. Machado in Brazil had treated 230 children with CP and reported improvement, interestingly, at the same dose that we were using for our divers and traumatic brain injury patients. So in the setting of this, now I evaluated this first cerebral palsy child. We were able to show improvement, and we were just blown away. This little 4.5-year-old couldn't walk, floppy, low tone, drooling, couldn't eat. And at the end of 80 hyperbaric treatments, he was fully walking, ambulatory, with fingertip support for just balance. Had stopped drooling, was able to eat. It was remarkable. So began a series of hyperbaric studies that were done. Well, in the process, in 1998, a father in Georgia heard about this, and his son had severe quadriplegic CP. And he decided he was going to get hyperbaric oxygen. He had seen the SPECT brain imaging that we were doing on the children before and after, documenting this. So he got a SPECT brain scan, and it was abnormal. Now, this child had only few words of speech, could say some words, but couldn't couple them together, just very limited, minimal speech, and of course had involvement of all four extremities. On the brain scan, where it showed a big focal defect was right in Broca's speech motor area 44 of the brain, which is right here in the temple, the frontal lobe. And there was a reduction in blood flow, metabolism there. He ended up getting 20 hyperbaric treatments for his son, just like we were doing with the children. And this child became fully conversational. And this was just in 20 treatments. It was remarkable. And his cognitive improvement, his thinking, even effects on his motor function were apparent. And Dad decided, let's get a repeat SPECT scan. And what showed up? A global improvement in brain blood flow, but a complete filling in of this speech area. The deficit there, consistent with now this child's improvement in speech. Undeniable evidence and proof. Dad tried to get Georgia Medicaid to reimburse for this because it was obviously a therapy that worked for his son. He got 20 more treatments and he was better yet. And then has done more treatments since then. Georgia Medicaid refused because it wasn't on that typically reimbursed list of indications. But this dad, David Friels, was not to be outdone. And he dug into this, and he went all the way back to the history of the Medicaid law, found the author of it who wrote it for President Lyndon Baines Johnson, and she told him why Johnson wanted this Medicaid law. He wanted treatment, medical treatment for children, and especially children who couldn't afford it. But he wanted also new treatments that maybe hadn't gone through the whole long, lengthy medical vetting process, but had some evidence, a good chance of improving children with these childhood neurological diseases and others. And so he wrote the Medicaid law, and it had two pathways that Medicaid would pay for a medically necessary treatment, which was standard of care, mainstream medicine, what was used for a child with a given condition. Or It would pay for therapies that could correct or ameliorate a condition. And that was put in there to bypass this very lengthy process that is a part of proofing and getting insurance reimbursement of a medical therapy or a drug. And so the father took Georgia Medicaid to court based on the Medicaid law that this clearly corrected and ameliorated his son's condition. And he lost. Well, then it got appealed. And in the process, he had contacted me, and I brought his son down, and we did the sequence of SPECT brain scan, single treatment rescan, to see if we could help him more. And of course, it showed still some damage, but improvement after one hyperbaric treatment. And so he got more treatment and improved. And next thing, I ended up in Georgia in court presenting this opposite a group of neurologists who testified against it. And what we were able to show and argue with the imaging was that this was a real treatment. And the judges sided with it. So much so this went to Court of Appeals and then the Georgia Supreme Court. And the decision was in favor of reimbursement of this father for hyperbaric treatment for his son with cerebral palsy. It turns out that template has now been used in at least 19 other states with parents who have sought and obtained reimbursement for hyperbaric oxygen for their child with a neurological injury. And it's a triumph, but it takes an awful lot of fighting and work for a parent to do that. And a parent with a special needs child has their hands full. It's a full-time job, to the point where often the other kids in the family get slighted because the special needs child needs so much attention. But what's happened is the studies that have been done, some of which were grossly misinterpreted by the medical field because they didn't understand that lower pressure treatments, even with air, were bioactive and were a type of hyperbaric therapy. The studies have now been all analyzed using foolproof mathematical tool that is able to evaluate a child's gross motor function done on the gold standard test and compare it to any other therapy that has used that test for measurement. And what has been shown now in a review article comparing the improvements in these children on the standard test, the GMFM, Gross Motors Functional Measures test, compared to all the other typical therapies used, standard PT, intensive PT, extremely intensive PT, Botox therapy, horseback riding, and surgery, cutting the spinal cord to reduce spasticity. Hyperbaric oxygen therapy is 400%, as effective as the average of all the others. The closest one was horseback riding, which was roughly 40% as effective as the hyperbaric oxygen, or 35% roughly. And it didn't have the same improvements that were shown across the board with the other functions, such as fine motor function, cognition, socialization, and speech. All of these improved in the hyperbaric oxygen groups and hyperbaric therapy groups with air that were not achieved with PT or any of the other therapies. So we now have undeniable evidence and proof that hyperbaric oxygen therapy is unequivocally the most effective therapy for children with cerebral palsy, and not just the motor deficit, but a global effect on the other deficits that can be present in these children and diffusely in their injured brain.